My name is Dr. Jaime Schwartz. I'm a board-certified plastic surgeon in Beverly Hills, and I'm one of the medical directors for Total Lipedema Care. We're here to answer your questions as we hope to also open more locations.
What is lipedema?
Lipedema is a connective tissue disease. It affects about 11% of the female population, which is actually pretty scary because that's the same as breast cancer numbers in the United States, and these numbers could even be higher. Connective tissues are your joints, ligaments, tendons, skin, things like that. So most people that have this are pretty flexible and pretty, you guys can do yoga really well. What also happens though is your blood vessels, your arteries, veins, lymphatics are also made of connective tissue. And what happens, those are also more stretchy or more leaky than the average person. The normal proteins and things that are in your blood leak out into your tissues, mainly dependent areas like arms and legs. Your body then forms an inflammatory response to that, and that is how the tissues grow locally in the area. When people say it's fat, it's not fat, it's thick connective tissue that is growing in response to inflammation.
Why is lipedema so painful?
So lipedema creates a lot of inflammation in an area where there's nerves. So it becomes very inflamed, including the nerves. Think about it as if you had a cyst or pimple on your face and it was something that was inflamed and hard. Everything hurts around there, it's all inflamed. When you take it out, it goes away. Lipedema is very similar, except it's all throughout the body.
Is lipedema an autoimmune disease?
So a lot of people ask if lipedema is also an autoimmune disease. We know it's a connective tissue disease. What I tell people is that answer is not that simple as yes or no. Some people can have autoimmune diseases that also mimic or also work with lipedema. However, for the average person, what we see is that because there's so much inflammation going on in the body, your body reacts to that in a lot of different ways. Some people will actually think it's autoimmune, or they'll see that in their numbers when they're checking with their rheumatologist, but I don't think it necessarily causes it to be autoimmune.
What are the different types of lipedema?
I actually have a different classification system the way I look at lipedema, and it's actually what I see in practice. I call it classical or centralized. When you look at classical, that's the one you see if you Google and see all the things, people, it goes all the way down to people's ankles. It really focuses on the lower body, and you get cuffing, especially around the ankles, which is really tough to deal with. Centralized for me, you'll have people that almost have no tissue below their knee. Their ankles look actually pretty normal. They hold it mainly in their thighs, the buttock, shelf, hips, mainly in the midsection here. And I also think they have a higher propensity to have it also in the arms. The difference between these two is that when you have your centralized, people, the good thing is you can show your ankles. People wear skirts, you can wear shorts, you can do things like that. The negative with that though is because the tissue is really in your midsection, it's harder for people to sleep. You can't get comfortable, it really hurts. You can't sit down for long periods of time. It really is, it's tough to deal with. So more importantly, I try to do these classifications to make more sense for us, but also so that people know just because it does not go down to the ankles doesn't mean it's not lipedema.
Can lipedema come back?
Another extremely common question is, once we treat lipedema, can it come back? The answer is yes. It's a genetic disease, it's a genetic disorder. I tell people I can fix it, but I can't change people's genes. However, what we've seen with our patients as people follow us with our manual lipedema extraction, or MLE, is that I tell people the skin is here, the muscle's here. Our goal is to take out as much or everything in between those areas. When we do that for people, we have not seen it come back. Again, it can come back with our surgery though that's been so thorough, we just haven't seen it even years down the road.
What is a lipoma?
Lipomas are benign fatty tumors that grow in the body. They can grow anywhere. They have a capsule. When you take care of them, they tend to not come back as long as when you open it, you take the entire thing, including the capsule.
What is the difference between lipedema nodules and lipomas?
So a lot of people ask me, as they know we treat lipedema in a very great way. We get out all the nodules that are there. And then a lot of people ask me and say, are those lipomas? So they're actually different. Lipomas are normal benign tumors that happen in the body. They can grow anywhere, they can grow a lot, but most people get a few of them. They're also not as hard, they're vascular, they have a capsule, so when you're taking them out, you have to take out everything. Lipedema nodules come from an inflammatory process. They're very hard, thick, firm, fibrotic. These are things that are causing more inflammation there. They not naturally, your body doesn't want to have them there anymore. So that's really the difference. You want to take both these things out, however, taking them out and treating them is a little bit different.
What is lymphedema?
Lymphedema is a process where your lymphatic system is not working extremely well. It typically happens in the lower extremities, like your legs, and usually just one side. However, it can happen after surgery. I used to take care of a lot of breast cancer patients, and you'll see it in their arms after they've had axillary lymph node dissections. The difference with this is that it's a fluid buildup that you cannot get rid of. In order to treat lymphedema, you really want to use compression to really get the fluid back up into your body.
What's the difference between lipedema and lymphedema?
One of the most common things that we hear from everyone is they confuse lipedema and lymphedema. So you can see some basic things overall. So lymphedema typically happens in one leg or one extremity, arms. Lipedema tends to happen throughout the body. You usually see it in both legs, both arms, the stomach, the buttock shelf, so you see totally different things. With lymphedema, since it's primarily a fluid overload, you'll get something called pitting edema. What that means is if you press on the skin, you'll see an indentation that takes a few seconds to actually come back. With lipedema, it's opposite. The area is very firm and fibrotic, and if you press on it, it'll be painful, which you don't see in lymphedema, but also you're not going to see that pitting edema. You're not going to see that softer area that's there. With lipedema, you'll see a lot of pain. You'll see easy bruising. You'll see it's very tender. People say their legs or their arms feel very heavy when they're walking. They'll get muscle cramps and what we call restless legs or Charlie horse. So there's a lot more differences that go with this. Also with lipedema, since it's a whole body inflammatory process, a lot of people have what we call constitutional symptoms. They'll have fatigue, memory loss, brain fog, they're not hungry. I tell people it's almost like flu-like symptoms. So they really are completely different, even though you'll see swelling in the extremities.
Can lipedema be treated by liposuction alone?
So if you look at the literature and you look what has come out, especially out of Europe over the past 20 years, people will say they use liposuction, gentle liposuction, lymphatic sparing to get rid of the lipedema. However, when I see people that are more advanced and they have very nodular tissue, that's not going to come out with liposuction. In fact, I think as you're trying to get those nodules and be even more aggressive with your liposuction, you might even be causing more damage in there. What we found is by massaging and removing the nodules, and you can actually feel them kind of pop off the fascia to really get them out, we find that that's actually less aggressive, less invasive, and it's gentler for people, and they feel better even the next day.
What is MLE, or manual lipedema extraction?
So the way I explain to people how we best treat lipedema is by thinking what's going on. So I tell people the skin is here, the muscles here, all the tissue in between is lipedema tissue that's actually causing inflammation. By getting all this tissue out, we reset the system and people feel better. When you do liposuction can get out some of the softer tissues. However, it's not going to get out the firm, hard nodules, especially ones that are attached to the deep fascia here. In fact, we've actually pulled out nodules, you can see, where they'll have a cannula hole or a liposuction cannula hole through them, and you can see they're still in there, they haven't come out. By massaging the tissues and popping or actually moving the fibrosis and mobilizing all the nodules, you'll see that we can get all of that tissue out for people. People come in the next day after surgery and they'll say they're not in pain anymore. Before surgery, they're in pain. The day after surgery, they're sore. Sore means they're using Advil and Tylenol. Pain is narcotics and all the other things that we're using. But more importantly, when somebody says that the next day after surgery, we know that we've done a thorough, good job for them.
What type of anesthesia do we use?
We actually use what I consider the most advanced anesthesia technique you can actually do in the United States. Everything that we use is by IV. And the reason I say that is when you use anesthetic gases, the old way of doing anesthesia, gases are fat soluble. They stay in your body for days after surgery. That's why people throw up. Days later, they feel like they're hit by a Mack truck. Like, it's really not great. Everything that we use is fast on, fast off. The other reason we like to do it is it's considered general anesthesia since you're asleep. However, we take it to a different level. you're breathing on your own the whole time. We don't paralyze you. We don't keep your blood pressure low. We even have something called the SedLine monitor. We can actually monitor your brain function and activity, so we can see, like, do you need more anesthesia, do you need less? We try to keep it at a level where you're able to wake up and recover a lot faster and a lot better. I think the most important for recovery is that it's called an active recovery. We want you up and out and walking around even that night.
Will I need an arm lift or a thigh lift?
Very common questions, especially since lipedema affects the extremities, the arms and legs, is do I need an arm lift? Do I need a thigh lift? What I tell everybody, which is actually completely true, is that we don't know how your skin is going to react to surgery. For some people, it shrinks up really nicely. Other people, it really hangs. However, the most important thing that we figured out over time is that to stage the procedures. Arms and thighs are the hardest things to heal. They're just areas that you want to move and do stuff, so to get them healed is very difficult. What we found at Total Lipedema Care is by removing all the tissue, all the lipedema tissue, and decreasing the inflammation, let everything heal and shrink up. At that point, we then make a decision together, do we need an arm lift or thigh lift? And also at that point, when we do the procedure, we can probably even take less skin, and it's probably going to be tighter, and your chance of healing or not having healing issues is just a lot higher. So the honest answer is we work together on this, but it's really, again, up to your body.
How long should you wait between procedures?
So a lot of people ask, generally, how does our surgery work and how we break things up and stage things and how long in between? So the most important thing that I tell people is we do stage the procedures. What we do is very, very thorough. One of the major things we do is we break the body up into front and back. There's a lot of safety reasons for doing that, which is much better for you, including the faster healing. When we do have multiple stages, the average time between the procedures is about 8 weeks. What I tell people, though, it's not so much the timeline, it's more up to your body and how you do. That's what determines how long between procedures. There's no rush to get things done. We're always going to do things when it's best and safest for you.
What are the complications of lipedema surgery?
People ask about complications from surgery. We know the surgery is big. So the things that I'll say we worry about the most, and it's actually pretty simple. The skin is here, the muscle's here, we're taking out as much tissue in between that area. The number one thing I worry about is called seroma, or fluid buildup. So if you have a lot of lax skin or open area, we'll actually put drains in to hopefully drain that fluid. The thing we worry about probably the most, though, is because we're taking out so much tissue, we worry about blood supply to the skin. It's one of the reasons we don't go completely around the leg in one procedure. It's also the reason why almost all of our patients are electing for hyperbaric or high pressure oxygen after surgery. That allows oxygen to get to these tissues that are inflamed and have already been operated on. The other things you think about, since lipedema is a connective tissue disease, we do think people with lipedema have a higher chance of getting blood clots, which is called DVT. So we do put people on blood thinners after surgery with our anesthesia. Since it's activating, you're not laying in bed, you're walking around. That's actually one of the best things you could ever do. And we give you a lot of IV fluids. So those are the things we worry about the most, and we hopefully will never ever see.
What happens post-surgery?
With the type of anesthesia that we use, we actually see some interesting things. So one of the things are, typical anesthesia in the past is very sedating. It keeps you asleep. You can't move. You're throwing up. Ours is different. Ours is actually activating. And the reason I say that is the first night, first of all, we give people a lot of IV fluids during surgery. So every 15, 20 minutes they're peeing. That does force them to walk around. But people do have problems sleeping the first night because they actually feel really good. It's a different type of anesthesia. It even lasts into the next day. So when people come in the next day, even if they're long, big procedures, they actually feel good. They're walking, they've been eating. It's amazing to see. And we think the care after that and how they heal is much better when you're up and active and doing the things that you should be doing.
Does BMI matter?
One of the most controversial things we deal with is BMI, or body mass index. For those of you that quote me and have seen previous things, I will tell you, and you can use this, BMI is the dumbest number on the planet. Somebody a long time ago said you take somebody's height and their weight and somehow that's a magical number that puts them in a category of how they're going to do in life. In fact, if you look at it, I'm obese. All of us are obese, so it doesn't really make sense. It makes it even harder for people with lipedema. The problem is it's not fat. You can't starve yourself. You can't do gastric bypass to get rid of it. So your BMI goes higher, and then doctors will say, I can't treat you until you lose the weight. Problem is you can't lose the weight. What we've learned is we take care of people with higher BMIs. We don't have a cutoff or a limit, because the reality is I have some patients that are 350 pounds that are healthier than I am. We really don't look at people that way at all, and I think it's a terrible way to classify or categorize people also.